Hi, I'm Preston Smith, Dean at the College of Medicine. And I want to thank everyone for joining us this evening. I'm pleased to welcome you to tonight's event. Before we begin, I want to acknowledge that we are on Treaty 6 territory and the homeland of the Métis. We pay our respects to the First Nations and Métis ancestors of this place and reaffirm our relationship with one another. As is often the case in this digital world in which we live, I do acknowledge that there are people viewing this event on treaty territories in other areas of Canada. And in fact, in the College of Medicine, a large number of our students and faculty are in Treaty 4, and we have students, faculty, and residents in 2, 6, 8, 10, as well as 4. So we really want to acknowledge all of the Indigenous people of this province and those that are those communities wherever anyone is located. This evening, we are privileged to hear from Dr. David Mulder, recipient of the USask 2021 Honorary Doctor of Laws degree. Certainly, I'm proud to say that he's a graduate of the MD class of 1962. He will share details of his high-profile career as a physician and exceptional journey as a scholar, researcher, and healthcare leader. Dr. Mulder's presentation will be followed by a time where we will answer attendee questions that were submitted prior to this evening. President Peter Stoichev and Chancellor Grit McCreath are here with us to say a few words about Dr. Mulder. A brief reminder to please keep your cameras on whenever you can, and please keep your microphone turned off. It's my pleasure to now turn this over to President Stoichev.
Thank you very much, Preston, and everybody. I'm so honored to join you all for this event and so pleased to be here this evening to say some words about Dr. David Mulder. We are so proud and so fortunate to claim him as an alumnus of the University of Saskatchewan. His remarkable contributions to the field of medicine have spanned more than half a century, and he's renowned across Canada as one of the most highly respected surgeons of his generation and a true pioneer in trauma surgery. As the chief surgeon at Montreal General Hospital, he's credited with being the driving force in developing a province-wide trauma treatment system in Quebec in the 1980s, an advancement that helped to reduce the trauma-related mortality rate in the province by 50%. In addition to being the surgeon-in-chief of the Montreal General Hospital, Dr. Mulder was the chair of the McGill University Department of Surgery, and he's currently the H. Rock Robertson Professor of Surgery and senior surgeon in the Division of Thoracic and Upper Gastrointestinal Surgery. McGill has also named a research chair in surgery in his honor, and it has paid tribute to him by renaming the university's trauma center at Montreal General Hospital the Dr. David S. Mulder Trauma Center. Along with these notable accomplishments, Dr. Mulder has enjoyed a parallel career with the National Hockey League as the team physician for the Montreal Canadiens for more than 50 years, during which the Canadiens have won 8 Stanley Cups. In addition to attending every game at the Bell Center and working with 5 decades of legendary hockey personalities, he was instrumental in advancing early awareness in diagnosis, treatment, and prevention of head injuries. In recognition of his outstanding career as a scholar, researcher, and healthcare leader, Dr. Mulder has been the recipient of many major awards and tributes, including being made a member of the Order of Canada, the country's highest civilian honor. And at our fall convocation ceremony, the University of Saskatchewan recognized Dr. Mulder's extraordinary contributions and accomplishments by awarding him an honorary Doctor of Laws. This degree was conferred by our Chancellor Grit McCreath, who is here with us this evening to say a few words about the significance of an honorary degree. Thanks, everyone. Thank you, Dr. Mulder, for joining us this evening. And it's now my pleasure to turn it over to Chancellor McCreath.
Thank you so much, President Stoichev, I am so pleased to be here this evening with Dr. Mulder and all of you, although I do wish we were in person. Dr. Mulder was awarded at our 2021 Fall Convocation Ceremony with an honorary Doctor of Laws for his outstanding scholarly achievement and exceptional service to the community at large. An honorary degree is the highest honor the University of Saskatchewan can bestow. Through conferring honorary degrees, we recognize individuals who have achieved outstanding accomplishments in research, scholarly, artistic, athletic, public service, or philanthropic work. Dr. Mulder more than fulfills this profile through his medical career alone. But in addition to his work as a surgeon and researcher, he has championed many causes, including those through the Montreal General Hospital Foundation that have helped improve healthcare resources in Quebec. We are so pleased to have Dr. Mulder accept this honor and join an esteemed group of honorary degree recipients. On behalf of the University of Saskatchewan, we congratulate you on this achievement and thank you for your contributions, Dr. Mulder.
Thank you, Chancellor McCreath. We're honored to have Dr. Mulder share details of his work and career achievements with us today. We're so proud to claim him as an alumnus of the College of Medicine and to celebrate his achievements. Our graduates have important roles in healthcare and science and are needed now more than ever. Our students and alumni have great ambition to make the world a better place. Dr. Mulder is an example of that as a healthcare leader, physician, and scholar. At the College of Medicine, we train physicians, scientists, researchers, and physical therapists the world needs. Dr. Mulder epitomizes the qualities we seek to develop in our graduates: competent, compassionate, resilient leaders who serve their communities and confront health inequities. His achievements inspire and challenge all of us to reach for our highest potential. I'll now turn it over to Dr. Mulder.
Thank you, Dr. Smith. Let me first say how truly honored I am by this recognition. To be acknowledged by one's alumni and alma mater is very special. I'm pleased to talk with each of you tonight, especially the students who are in attendance. I chose a topic that is dear to my heart, and it addresses the subject of making a career choice in medicine. And I want to speak to you about it tonight from three different perspectives. First of all, I'm going to speak to you on a personal basis about my own career and how it was so heavily influenced by mentorship. My mentorship in Saskatchewan was not organized. It happened by chance. And I will never forget my first mentor, meeting him, and that was Dr. David Mulder. I don't know, probably not as well known to people in Saskatchewan now, but at the time of when I was a third-year student, he was considered to be Saskatoon's top physician, if not Canada's top physician. And so to be invited to do a shadowing session with him in his office was monumental. And I recall the fear and trembling. I lived on King Street at that time, and I walked along the Saskatchewan River by the Bessborough and then to his office. And we had 4 hours of where he simply saw patients and discussed each one with me. In third-year medicine, it was the first time I saw patients outside of the hospital setting. It was an incredible opportunity. Noontime came, and we'd seen patients with hyperthyroidism and you name it. And he said, I don't really have much to offer you for lunch, but if you'll have half of my egg salad sandwiches, I'll get you a glass of water out of the cooler. And so we had a 1-hour discussion, each sharing an egg salad sandwich. And he talked to me about careers. And he said, you know, Dave, I'm in private practice, and I chose that for many reasons. But he said, medicine is so broad and offers so many opportunities that you can be in private practice, you can do primary care, you can be an academic physician where you have the opportunity of seeing patients, teaching students, and doing research. And he said there are many other venues. And I think, then he said to me, what are you thinking about? And I said, well, I'm still at the stage where each rotation I finish is going to be the career I choose. And I said, but I'm leaning a little bit towards obstetrics and gynae or maybe surgery. He said, Dave, follow your heart. He didn't say follow your brain. And that was advice that I've always remembered. The second mentor that comes to mind at the University of Saskatchewan was Eric Nansen. He was the chair of surgery. And I have to admit that I was absolutely terrified of him. He was a New Zealander, tough and demanding. And his lectures were always at 8 o'clock. And at 8 o'clock, he locked the door and then took attendance. And so we were all terrified of him. But as in third year medicine, I used to come and watch him operate at night, and he got to know me, and he asked me if I'd like to work for him for the summer. I said I would be thrilled. And so I worked with him in the dog lab, and we created a experimental model looking at gastric physiology. And he taught me how to create a Heidenhain pouch in dogs. And we had a very good summer. By the end of the summer, I was operating very comfortably, making these pouches myself. And certainly it was a real look at surgery. We published a paper, and I was thrilled that it got published in the Annals of Surgery, a prestigious journal, and clearly it motivated me in the academic venue. So I'll never forget the influence that Eric Nansen had on my career. The third person I have to mention is Dr. Joe Stratford. Dr. Stratford was the head of neurosurgery there. He'd come from McGill, from the Montreal Neurological Institute, to replace Dr. Bill Findell, who we'd all got to know. And Dr. Stratford became the advisor to our class. So I got to know him. And at graduation time, Dr. H. Rock Robertson was a visiting professor. And Dr. Stratford introduced me to him. And talk about indecision in career making. I had applied to several areas and was about to accept a position at Flint, Michigan, when I met Dr. Robertson, and he said to me, what do you want to do with your life? How are you going to spend the rest of your life in medicine? And I said, well, I'd like to become a surgeon. He said, why don't you come to the Montreal General Hospital? And I said, well, I didn't apply there. Oh, he said, that doesn't matter. He said, if you'll accept my handshake, you'll have a job after you finish your internship at the University Hospital a year from then. So I shook his hand, and when it came time to leave after my internship at the University Hospital, by this time I was married and had a young child, and I had a hard time explaining to my wife's father about where my letter of employment was and how I was going to support his daughter. I went to the Montreal General on July 1st. We drove across Canada, and my job was there. Mrs. McMurray, as he said, welcomed me with open arms. And I spent the rest of my career at the Montreal General Hospital, which was a phenomenal experience, a real opportunity. So that's my personal story about career choices. I think it's rather unplanned. And as I look at medical schools across Canada now, I want to address the students who are thinking of a career choice tonight. And I want to recognize that almost every medical school in Canada now has a very planned career choice program. At McGill, a career choice is in first year, second year, third year, and fourth year. It covers the whole spectrum of the College of Medicine. And so I have developed an approach, a personal approach to career counseling that I clearly has influenced by many things in my life, but it was something that I developed at McGill University. And it's a 4-phase program. And I start with phase number 1, and I think maybe the important thing, and I call it understanding oneself or understanding yourself. And I think as you're looking at a career choice, you have to remember who you are, what your attitudes are, what your skills are. And as Shakespeare once said, to thine own self be true. I think we all do better at what we all do well, what we like to do. There's no question that's an important factor in a career choice. The second point in my program is that we have to look on, you have to explore all of the options. And that means to look at each specialty in terms of work hours, night call, night duty, and look at work-life balance. And I think those become really extremely important things in a career choice. Fortunately, medicine has many opportunities, and you can approach it from the clinical side, from the research side, from the teaching side, and even administration or managerial. So with all of those options, then the third thing is you have to finally make a decision and choose your specialty. And I think with the background that I've given you, once you make your choice of specialty, then you have a big decision. Where am I going to accomplish this? Am I going to do it locally? Am I going to go abroad? And what are the reputations of each program and each university? And these are always specialty related. And the fourth point that I've become really adept at now is after the student makes the choice, then you have to apply for the program of your choice. And that involves a lot of stick handling in terms of the CARMS match, the USA match, and I've now even become used to the UK match. And all of these things are important factors. So the students listening tonight, I think it's one of the most important decisions that you'll ever make. And you'll notice one thing I've mentioned, I've never used the word a gender issue. I think career choices now, there are no gender issues. The McGill Department of Surgery is led by a female. Our own division of thoracic surgery, 2 out of 6 are women and doing well. Our orthopedic department has 2 or 3 female physicians who are really doing a marvelous job. So there are no, in my mind of career choices, there are no gender issues. The third perspective about career choice comes from my role as a healthcare planner and as a faculty member. In Quebec, we've recently had a difficulty in having enough primary care physicians. As you know, every healthcare system has to have a balance of primary care and specialists. And so we took to interfering with a program that was in effect, and we looked at different solutions. The first one we used, we adopted from the UK. We increased the number of medical graduates. And that maybe helped primary care a little bit, but not very much. Everybody pretty well stuck to their own pathways. Then we looked at carrots and sticks, and we looked at limiting the number of primary care positions in the city. We looked at providing financial incentives to go to the rural parts of Quebec. And I think we're only now getting to improve that balance. But it's so these are the 3 important things about career choices. The other thing I wanted to mention is, as you have heard, I've had a genuine interest in athletics and sports medicine, and I've had the unusual exposure to giants in the hockey industry. And I'll just mention two or three. I started with Hartland Molson, who is the patriarch of the Molson family, and what I learned from him in terms of philanthropy and loyalty to his two institutions, the Montreal General Hospital and the Montreal Canadiens. The next person I'd mention is Sam Pollock, who is the general manager of the Canadiens, and from him, he taught me a work ethic and attention to detail like I've never seen before. And then, of course, I've been exposed to several hockey coaches, Toe Blake, Scotty Bowman, and both of these men have taught me invaluable lessons. And I think if you can find a hobby or a pursuit like I did, it brings enormous satisfaction. And I think it adds to your to every aspect of your medical life. And so I would end by quoting Alfred Lord Tennyson, that I am a part of all that I have seen. And truly is a true honor to be here tonight and to address our current medical students who have an amazing opportunity ahead of them. So thank you for your attention, and I'm open to questions.
Thank you, Dr. Mulder, for that inspiring look into your career and journey you've taken since graduating from the College of Medicine. We will now begin with the question and answer portion of tonight's event. Thank you to those of you who have submitted a question in advance. We selected a number of them to answer right now. The first question is from Evan Hildebrand in the College of Kinesiology, who asks, what does your role on game day look like? And do you ever have to go out onto the ice?
Well, that's a very good question. Thank you, Evan. Game day is a very clear-cut schedule. During the day, I often hear from the trainer or athletic therapist who tells me about who can play and who can't play and what items we may need. And then it's my obligation to arrive at the Bell Center at least 1 hour before game time. And the home team physician is responsible for the medical care for both teams. So at 6 o'clock, I walk over to the visiting team, meet with the trainer. Occasionally now, some teams travel with a physician, and we clue them into the medical aspects of our building. We show them where the X-ray room is. We give them a pathway for the ambulance to leave the building. We have an emergency action plan, which we go over with the therapist and the physicians if present. And then I go back to our own side, to the Montreal Canadiens side, and tidy up some items that might need some last minute attention. But it's a pretty exciting schedule.
Great. Thank you, Dr. Mulder. Our next question is from Melissa Wood in the College of Medicine, who asked, what was the most frightening or scariest moment of your career?
Well, there's absolutely no doubt the most frightening and scary moment was Trent McCleary and his injury. And you probably all know he's from Gull Lake, Saskatchewan. And he and I bonded related to our Saskatchewan and our farming roots. And so I had a very close personal relationship with Trent, and how shocked I was when he took a slap shot in the neck, which struck him in the larynx and fractured his larynx and virtually immediately obscured his airway. He was rushed off. We have a very good treatment room at the Bell Center. It's like a small operating room. And we tried, and there were several physicians present, not just myself. We tried to intubate him, and we were unable to. And he was coughing up copious amounts of blood. And I thought for sure he was going to die. We got him in an ambulance, and it was a Sunday afternoon, mild snow in the road, but it was NFL Super Bowl day, so traffic was light. We got to the Montreal General Hospital, in jig time. The time, in fact, from the on-ice injury to the operating room was 17 minutes. And we had flown the hospital. We didn't stop in the emergency room. We went directly to the operating room, where we were met in the corridor by an anesthesiologist who gave him a muscle relaxant. We were able to intubate him, and we went on, carried out a tracheostomy, and eventually had to put a chest tube in for a tension pneumothorax. So very clearly, that was one of my most frightening episodes. And I don't know, any of you who read the sports literature will recall that in the last week or so, there was a young man in Connecticut who got a skate laceration to his neck, transected a major blood vessel, and bled to death on the ice, and has led all of us in hockey to review our protocols and to adopt the American College of Surgeons protocol, Stop the Bleed. And we're working on a poster that we're going to try and get dispensed by Hockey Canada for every rink in Canada and the USA. But the hockey is a fun game, but it's associated with life-threatening injuries.
Yeah, there's little doubt the compromised airway that you're unable to intubate, especially in such a traumatic setting, would be one of the, I can imagine. But also, I just think of all of the things that you've seen in your career in trauma and in surgery. It's certainly significant that the most scary one was actually on the ice in your hobby role, as you called it. Thank you, Dr. Mulder. Our next question is from Amanda Kleisinger, who asks, how have you seen the role of female medical practitioners change over time in sports medicine?
Oh, Amanda, that's a very good question. And as you know, when I was a medical student, there were very few women in medicine, and certainly none of them in a surgical role. And I would go so far as to say no one in sports medicine. I'm so pleased that that has all changed, and that you'll be happy to know that one of our mainstays in our medical team in sports medicine is Penny Bayless, and she's was a physiotherapist that went on to medical school and then took up sports medicine as a career. She's been a leader at McGill and indeed internationally. And I think there is a tremendous role for the female physician in this role. Highly commended.
Thank you, Dr. Mulder. Our next question is from Dr. Renee Kennedy, who asks, what advice would you give to a student to help them decide on a career choice if their preferred field has limited potential positions?
Well, that's a really critical question, Renee, because that's in a way how we judge how many people are going to be in the specialty. But I have faced many dilemmas like that, and I've gone through the agony of defeat when a candidate that I had been sponsored to go into thoracic surgery or orthopedics or plastic surgery, and they didn't get their chosen specialty. I recently had a female who had her heart set on being a thoracic surgeon, and for the very reason that you described, didn't get accepted. And I encouraged her to go into emergency medicine, and she did this, and she's become our mainstay in our emergency room. And so I think there are alternatives for career choices, but it's a difficult thing to handle when you're the one who's been turned down.
Thank you, Dr. Mulder. We have time for one more question. Faith Fensky from the College of Kinesiology asks, do you have any advice for individuals who are just starting their sports medicine careers?
Well, I think just like starting any career, you have a good foundation in medicine. People have often asked me what rotation should they take, and as you know now in the U.S. and in some places in Canada, they have a 2-year curriculum for sports medicine, which includes rotation through things like orthopedics, the emergency room, the operating room. They do special sessions on nutrition for the therapists. And so I think all of these things are important. I think it's, for me, it's one of the things that's helped me the most in sports medicine has been the fact that I played the game myself, and I understood very, very well what it meant for an elite athlete to suddenly have his or career threatened. And so I think playing a game or being involved in a game, a sport is vital.
Thank you, Dr. Mulder. Really appreciate you answering these questions, and thank again all of those that have submitted questions for us this evening. We'd now like to announce the recipient of the Door Prize, which is a copy of Dr. Mulder's book, Hockey Doc, 50 Years of Stories on 50 Years of Medical Care to the Montreal Canadiens. Hopefully everybody can see that. And so I just have to pick up my phone here, and congratulations to Pavlo Zerbecki. You are the lucky recipient of a copy of Dr. Mulder's book. And so congratulations, and certainly hope you enjoyed that book. And certainly, Dr. Mulder, we actually bought a second copy for the Dean's office. And so I'm going to be reading your book on whenever meetings end early. That doesn't happen often enough, unfortunately, but I will. I look forward to also having a look at your book.
Well, thank you. You'll be happy to know that the French edition came out today, which is important in the province of Quebec.
Oh, absolutely. Particularly, well,
Yeah, I hope you enjoy reading it as much as I had putting it together.
Yeah, no, well, I'm from New Brunswick. I was telling somebody else that recently that Maritimers cheer for the Leafs, the Canadiens, or the Bruins, but the Francophones in New Brunswick are always cheering for the Canadiens. So
yes.
So certainly that concludes our event for this evening. I want to thank you again, Dr. Mulder, for joining us, and everyone for attending.